finally, a source of raw, real, and honest information on healthcare issues that matter most. Welcome to BS Free MD. From the latest medical information to how to stay sane as a doctor or a patient, no subject is taboo, no BS is allowed. Now, let's welcome your hosts, Doctors May and Tim Hindmarsh.
We're back again with another amazing guest that I know you guys are going to find this episode fascinating. We should just call it Butchered by Healthcare, because that's the title of this, of one of the books written by our guest today, Dr. Robert Yoho. He is a now retired physician who spent 3 decades as a cosmetic surgeon after a career in emergency medicine. And he has now become a whistleblower, so to speak, and has written about the fraud in healthcare, from physicians to corporations to pharma to insurance. And his book is available on Amazon. He also has another book on hormone replacement as well, on the use of natural hormones, and it's called Hormone Secrets. But I think you're really going to love this conversation that we have, because we've had a long-standing belief that healthcare is fraught with fraud, so to speak, right, Tim?
Yeah, I mean, this was probably 20 years ago. I said I wanted to start a new specialty called anti-bullshitology, because, you know, the further I got away from medical school and the more I got immersed in the practice of medicine, the stinkier things got, as far as like, how come everything we do is just pills? And how come we can't bill for counseling somebody? Well, you can for counseling, I guess, but how come it's easy? It's more lucrative for the doctors and the pharmacy companies to be in lockstep with prescribing pills and getting patients out of the office than actually doing things that really work.
Yeah.
And so, I mean, that was it. Like, I remember being in meetings and people would say, well, you can't do that because we can't bill for it. And I'm like, you understand what you're saying, right? Like, you're understanding what you're saying. Like, thank you, madam from the Bunny Ranch, you whore.
Well, let's get into the show, but quickly, a word from our sponsor this week, who is MR Insurance. Michael L. Relvis is a CFP professional insurance agent committed to helping physicians nationwide with their term life and disability insurance needs. He provides an objective, transparent, and education-focused process that aims to help physicians make prudent decisions and avoid overcomplicating things. He exclusively offers own occupation disability insurance policies for residents, fellows, and attending physicians. And we really like Michael and know he's got your best interest at heart when it comes to disability insurance. And we know he'd be happy to help you with whatever your needs are. You can email him or call him, reach him at mr-disability-insurance.com, or call him at 1-800-817-4522. I will link it in the show notes. He responds very quickly and is really helpful, kind, and thanks again, Michael, for being here for us.
And believing in us. All right, on with the show.
All right, here we are today. Super excited to talk with Dr. Robert Yoho, our guest and author of a book called Butchered by Healthcare, which I'm fascinated by. And really going through the corruption in healthcare that's been happening for a long time, but really, I think, come to a head now with COVID. So welcome to the show, Dr. Yoho. Thanks for being here to share.
Thank you so much. And we're all colleagues here. We don't have to doctor each other. And
Perfect.
here's the 10-second disclaimer. This is not medical care. If you have medical problems, go see a licensed practitioner. And what's the other? Anyway.
Yes.
And to use this at your own risk, right?
This is for infotainment purposes only.
Right.
That's what we always say. Exactly. So tell us, for our listeners, a little bit more about your background. I mean, I know I've been reading on your bio and your webpage, but tell us a little bit about your background and what was the impetus to get you into writing this book?
Oh, May. I've been a bit of an iconoclast with my medical career, and I originally, I've done training in several different fields: internal medicine for a year, and then dermatology for a year, and then I board certified in emergency medicine. And I practiced that for 2 years. I quickly decided that wasn't for me. It was just, too many night shifts and too much insanity. So yeah, I mean, you're doing it right now though. And I understand that. But if you look forward to your whole career and imagine that, it's a bit of a rough pill to swallow. Anyway, I studied and I trained and I learned, and over a decade period, I went to a training program once a month. And I finally ended up practicing full-time cosmetic surgery. So I ended up doing breast augmentations and liposuction and facelifts and that sort of thing, and developed a huge practice and a loyal following. So towards the end of that time, I was doing a lot of hormone therapy because my patients aged with me, right? They matured with me. That's a nice way to put it. And by the time I finished, most of my women, and it's all women. And what I always tell people, May, that it was a fabulous practice, except for one thing. You know what that was? It was the women.
I was going to say,
and it
they're
was
a little
all
demanding.
Women.
They're a
It
little
was all women.
demanding.
My wife was great. She was my female wrangler, and so she helped me handle it.
That's
It's
funny.
true story.
Yeah, well, I couldn't do urology just because it's mostly
female
all men.
wrangler. I literally am.
Oh, stop.
I am hearing in my head the Yellowstone voices. You come back and she didn't like because the boobs weren't big enough and wasn't supposed to.
I thought it was going to be Blazing Saddles.
No. There are some things that are so historically incorrect.
Oh my gosh. Anyway,
so yes,
it's an arms race out there between those boobs, and they're getting bigger and bigger and bigger. And the ones with the biggest ones shoot down anyway. They're reproductively successful.
But man, now with things have been changing because there's so much. I mean, men are getting procedures now frequently. And I mean, you're in California, so you got I don't know if you're close to Hollywood, but you'd think that you're getting like a bigger proportion of men in cosmetics too, but maybe not in your time. I don't know.
Well, it was 10% or less for me. And
okay.
I still don't think it's a lot. I mean, a lot of the men have a body dysmorphic disorder variant. They're crazy about their hair, or they've got some little thing that they're, they're enlarging their penis or some crazy thing. And so I didn't deal much with them. I did a little liposuction on them and occasionally a breast implant on a transgender. No, I know.
There's a whole other bunny trail we could get into.
God, we don't want to talk about that. I just was tempted a couple times, and I don't believe it turned out well. But in any case, I ended up prescribing a lot of bioidentical hormones, and I got very interested in it. I studied, I certified, I took multiple courses, and I finally got this rinky-dink certification through World Link Medical. And I became fascinated with it, and I eventually wrote a book about it, Hormone Secrets. Mm-hmm. And so this thing is like a little guide for patients and doctors. And it since I wrote my Butchered by Healthcare first, it was informed by my knowledge of the medical corruption. And the reason why I got into this whole corruption thing was the hormone therapy was so corrupt. I mean, they have black box warnings on progesterone, estrogen, and testosterone. These are medications we have used for 50, 60, 70 years, and we've used thyroid for 120 years. I mean, it's crazy. Our clinical experience with these is overwhelming. And, they can do a women's health initiative study, spend $1 billion, the most expensive study in history, and nearly $1 billion, and they can make the results of it fraudulent, and it's been exhaustively criticized later, and I reference that in Hormone Secrets. And they can use drugs that were outdated or obsolete at the time that they were studied, right? And they published this thing in, I think it was 2002 or 2003, and it just scared the hell out of every woman in the country because they claim breast cancer was associated with estrogen, and it wasn't. That study didn't even say that. The study said that there was a very small, minuscule small increased incidence of breast cancer correlated with Provera, which is a synthetic progesterone. Right. And so that was about the most important finding. And this whole thing devolved into black box warnings on testosterone for thrombosis and cancer. I mean, it's just crazy. It's the safest, and it was such a political football that they made testosterone a scheduled drug. So I describe all that, and then I described the methods of treatment, the doses, and all that stuff, and along with the many patient anecdotes, including I have QR codes in there that you can scan and you can listen to my patients talk to you, on YouTube.
Wow.
Yeah, isn't that funny? It was a lot of work. My daughter thought of that idea.
That's like, yeah, that is a lot of work.
No, but it's really
it took a year to write that book, and
there's
3 years for Butchered by Healthcare. Go ahead.
No, sorry. So there's something that always comes up that just drives me absolutely bat what crazy, which is when you looked at that Women's Health Initiative, or the Nurses Health Study. There was a couple of them that did all that, looked at hormone replacement and all of these different things, and all cause mortality and heart attacks and cancers and the whole deal. When you looked at the hormone replacement therapy and breast cancer in particular, they never put absolute risk down. It's always relative risk. And so, and it drives me nuts because I've said this throughout entire COVID. I said, I don't care what side you're on.
The fatality is the only thing that make a difference. Yeah.
Right. I don't care what side you're on. Saying that there's a 700% increase in a death or whatever means nothing unless you know the absolute numbers, right? If you go from 1 death to 7 deaths, it's a 700% increase, but it doesn't mean anything. And all of these studies, and I think it started way back with one of the cholesterol pill studies where they switched. The FDA said, you can use relative risk rather than absolute risk. So you have these minuscule absolute risk reductions, but they might be a 30% relative risk reduction, which is nothing. And everyone thinks I have a 30% chance of getting cancer if I take progesterone. That's how the general public
I know
interprets it. And it's completely insane.
Plus, I remember because I was still doing family practice at that time. And I had what I called a psychogynecology practice, which was mostly women, like 85-90% females, doing mostly gynae just by nature, as well as counseling. And I just remember this so well because it was like putting out fires and freaking out because all of a sudden all that data came out and women were panicking and they were all going to die from breast cancer. And I'm like, no. Like, you have to look at the numbers of the study, and it's all individual risk versus what's going on. It was a horrible time. And then, of course, it was like a complete 180 in the media, and women, like I said, they're freaking out, and it's just nuts.
Why did they do it? What was the goal of the pharmaceutical industry in those studies?
Well, this is a forensic examination, but it seemed obvious to the close observers, including me, that they did it to discredit drugs that worked and were cheap and were not patentable. You get it? So, it's crazy. They must have paid off the head of that study. I mean, they're just so, the pharma influence is pervasive. And we should just go over pharma for a moment. They're the most criminal industry in history, as measured by their settlements with U.S. federal prosecutors, $80 billion and billions of dollars every year. Pfizer, Johnson & Johnson, Glaxo, SmithKline, all have paid individual settlements of over $2 billion each. And Bextra killed 50,000 people. And just like this vaccine, they knew about it well ahead of time. And it was a criminal settlement. So Peter Ross has characterized them as mobsters. And Harry Lloyd, a Park Davis pharmaceutical CEO, said, if we put horse manure in a capsule, we could sell it to 95% of these doctors. So that's their attitude. So let's just talk about the FDA a moment for your listeners, just to paint the picture. Half of its budget is paid directly by pharma. So these agencies think of the companies as clients, and we must regard them as branches of the pharmaceutical companies. And the FDA and pharma, they work together to fake their drug patent studies. They use statistical manipulation. They allowed by the FDA, corrupt. And you just put your pointer in the center of the biggest fraud in academic medicine is absolute versus relative risk. So the research today is absolutely corrupted to the point where the BMJ, which is sort of the last journal standing, they had an editorial from July of 2021 that was time to assume that health research is fraudulent until proven otherwise. And Peter Gertsch said, the pervasive scientific misconduct has led to a research literature where one has to dig deeply to find the few gems among all the garbage. And so these medical journals are just prostitutes. Their editors are paid hundreds of thousands of dollars a year openly by the pharmaceutical industry and the medical industry, and corporate ghostwriters write 95% of their articles. And then they're allowed to get away with this stuff by calling it conflict of interest.
So how in the hell are studies allowed to be released, peer reviewed, then published, yet the people that peer review them and publish them in these journals do not get access to the actual data? They get access to the pharmaceutical sponsored published article, which they then review. How can you say you reviewed something when you don't get to see the hard numbers? That is like, I never really realized that, right? Like, I was like most doctors, you read most of the abstracts, you do this, you do that, you look at study size, you make some critiques and away you go. And I never really realized until this COVID stuff that the reviewers are not getting the absolute, like the rock bottom foundational data that the article is written about.
Yeah. The surprising thing to me is that the data that goes in the articles generally is reasonably accurate. It's just slanted and confused and all messed up. And in fact, in the Pfizer study of the vaccine, the data is accurate, but what they did was they used people who never got COVID, and they had very small sample size. They used relative and absolute risk to their advantage. And the data was not actually fraudulent, that they put in there. It was just the way they did it was fraudulent. And there are people analyzing that right now, just from the data in the published studies. And I'm in contact with one who's trying to publish the thing in the big journals. And I mean, it's absolutely damning just on the face of it from this published stuff. And there is a investment whistleblower that has come to the same conclusion, named Edward Dowd, who you've heard about, and you probably listened to his videos.
I don't know. I don't know anything.
I've seen a little bit of his stuff.
I'll send you that stuff, or we can put it in the show notes. But
okay.
But he's got this incredible BS meter in his nose, and he smelled fraud from the start, and he says he knows sociopaths and he understands financial frauds intimately, and the whole thing stunk from the very beginning. And then when he looked at the numbers, and he's got an academic background that's good enough to understand it, he understood that the whole thing was a fraud.
Well,
so,
and tell me, like, how can it be? I guess I'm answering my own question, but honestly, how can the FDA be funded 50% by pharma? I mean,
okay, here's how it works.
I mean, it's obviously a conflict of interest. So, like, how does it get by?
The way it works is in the early 2000s, like 2003 or 4 or something like that, they passed a law that was derided by many, that their funding would be through user fees during the patent application process. So currently, if the FDA refuses to pass one of these, drugs or horseshit in a capsule or whatever they are, they can not sometimes even make their payroll. So these guys are entirely a branch of pharma. And you've probably read Cialdini's Influence book. And it shows how gifts, even small gifts, have profound influence on people. And you've been subject to the drug reps and how they come around and they try to offer dinners and stuff. Even a dinner can sometimes get you laid, right? In a social situation, right? Okay, so the drug reps are taught these principles of influence, and they're taught the 3 F's of sales. And there's food and friendship, and I forget the third one, but sometimes they use the 4th F.
Yeah. Mm-hmm.
Yes.
The 4th F. Now, I assume your husband has never been subjected to that, but
that's funny.
Well, you glance at each other.
I have, but not by a drug rep. but no, it's exactly true. Like, it's amazing. People would ask me, they go, well, these direct to consumer advertising on television is so idiotic. Why are they doing it? And I said, because it works. These are multi-billion-dollar a year multinational corporations. They don't throw money away. They didn't get rich because they're dumb. They get rich because they're brilliant. Why do they spend however much on having a team of drug reps come in and pat you on the back and give you pizza? Because it works. If it didn't work, they wouldn't do it.
Right.
And it was amazing because I used to confront, some of these guys, and it was fascinating. When Seroquel, quetiapine, which is a atypical antipsychotic, it got they repurposed it essentially. They Austin powered the drug. They de-thawed it and brought the delicious
those things
spy back from the death.
kill you 10 to 20 years early. That's
because you get metabolic syndrome and you die of all your
yeah.
complications of diabetes and obesity. But at any rate, so they got this add-on indication for depression. So refractory depression, you've been on maximum doses of a regular antidepressant. You can add quetiapine and it works better. And they give me their literature and I look at it and they said, you have 75 patients in this study. You can't say anything about this. Plus, it's depression. So it's entirely subjective. You're not like you're doing blood levels on anything. And I said, this is meaningless.
Functional illness. That's what they call it in psychiatry. I mean, we can get into psychiatry next if you want.
No, and I sit there and I go, this is total bullshit. I will eat your food, but what you're showing me is entirely meaningless. And they just look at you with like doe eyes. And it's like, maybe we have to go to the 4th F to break this one.
We have the 4 Fs. Is that fun?
She's looking at you.
It was funny because we have a little acronym thing where we talk about 4 Fs to successful marriage, but it doesn't include, ironically, it doesn't include that one.
Yeah,
it's the faith, family, finances, and fun. So maybe it is under the fun department. I don't know, but anyway.
Well, it's how you make a family, so it might be under that too.
So let's go down the butchered by healthcare route. So you wrote that before the hormone? No, you did the hormone.
Well, I started on the hormone book and then I dropped it when I started getting very interested. Because of the corruption I discovered with the hormones, I started studying general corruption, and it was like a OCD attack that lasted 3 years. Honest. And I just wrote full time and I studied full time and I talked to people full time and tried to improve my writing skills and so on. And learned everything, including typesetting, and stuck that thing on Amazon, and it sells 30 copies a day now. It's not profitable. I pay that much for ads. I pay for Amazon ads. And so I'm hoping it has a small influence. So what part of I could just kind of go over some of the corrupt
Give
things.
us a global overview of the book, first of all. So when we talk about butchered by healthcare, years ago, we worked next to this other healthcare provider, and he threw this tape at me, and I was deeply offended when early in my practice that was like, doctors are killing people and medicine's the problem, and they create illness in people just to make more money. And I'm like, no, we don't. We have higher moral standards.
Well, right. But then, of course, the solution was colloidal silver.
No, I know. But I mean, I don't know what slant it was taking. But fast forward all these years. And so now it just boggles our minds. When we were doing family practice, even people are going in for chemotherapy and being promised, like, it's like, this is what we have to do. And the patient's thinking it's a cure. And the next thing, I'm like, we're spending gazillions of dollars on your chemo and radiation, and you're still going to die in like 3 months, and you're 85 or 90, and why are we giving your
we had
your spouse a triple bypass and a hip replacement?
We had a patient come into our urgent care, and one of the PAs asked me a question about management, and I said, oh yeah, what's the story? Well, he's 91 years old and he just had a stent placed, a coronary stent placed, and I'm like,
yeah,
you're kidding. You're punking me.
And then of course,
and it's like, and now he's having some like chest discomfort or whatever. How much of a workup should I do? And I'm like, the least you possibly can, because he's 90 years. I mean,
in that age group, medical care is abusive.
I know, but it's becoming more and more frequent because it's like, we can't let people die. We have all these procedures and things we can do, and the spending is just going crazy on both sides. I think patients as well as physicians in healthcare. So, in your book, what's the gist of the overview of the departments? I mean, there's obviously the pharma side, the medical side. I mean,
The insurance
the
side.
insurance side. I mean,
You guys hit the high
yeah,
points.
yeah.
So, you, I mean, we can talk about the stents, and it's 95% fraud. They, it's a complicated story, but not that complicated. But just to hit the overview of what my book's about, we mentioned the insurance industry. They take 20% off the top, so they actually have a perverse incentive to increase the total consumption. Right? Hospitals are another third of the total cost, roughly. It might be 40%, and they spend 10 to 15% of their receipts just on coding collections and other methods to whip money out of people. And they're basically, I characterize them in my book as ruthless pirates that are looting the patients who trust them. And so we talked a little bit about drugs. Medical devices are an identical situation. They're less control over medical devices because we don't have the study requirements for them. They get out of it with a certain kind of an exception that they have a device that's substantially similar to the old ones. And these companies have almost identical for their size criminal and civil settlements. I mean, it's incredible. And we talked about the journals and the academics, and mental health, I think, is the most corrupt single specialty. It as you mentioned, it's based on soap bubbles. And to put it more precisely, we have virtually no or very few placebo-controlled or sugar pill-controlled trials for any of those drugs. And it's all based on psychiatric opinion. It's very subjective. And there are huge groups that don't think psychiatrists should be in business at all, including the Scientologists, but not exclusively the Scientologists. So somehow the Scientologists got it right for that. So
now, patients, I mean, what you hear that was the big push in the last few years with, I mean, the rise of just everything, mental health issues, people saying that there's no access is a big issue. And there's a big push for more mental health, more spending in mental health.
Industry propaganda. It's absurd on the face of it when you have 17 or 18% of the populace taking
Right.
these toxic drugs that have never
Right.
been shown in proper study to work, and who are horrendously addictive, and they doom a person with a casual 15-minute office visit. You can doom a person to be addicted to that crap. And I'm talking specifically about SSRIs.
Right.
And each class of those drugs has horrific problems associated with them. The SSRIs, among other problems, and the addictive qualities, have the violence associated with them. And many observers think that the mass shootings and so on and so forth have been, and it's certainly associated, but whether it's causal or not, you can't tell for sure. But it doesn't look good. We've never had women drowning their own babies before these SSRIs, at least not that I knew of.
No, it's fascinating because I've had the emotional ups and downs of life, and it's like maybe I'm depressed, this and that, and I was on 2 or 3 different SSRIs off and on, and finally I looked at I forget which study it was, and basically to show that it was a meta-analysis, I think, to show that SSRIs actually made a difference. You had to be so profoundly depressed that you were basically not taking a shower and never getting out of bed. And so I said, this is all horseshit. It's 100% placebo. And it took, I gutted it out.
Months.
And it took at least 6 months, if not a year, before all of the withdrawal effects were gone. And I was like, I will never go back. Like,
just think if you were on that stuff for 5 years, you're stuck.
Yeah, you can spark me with the jumper cables before I'll go back and do that again.
And of course, that he's referring to electric shock therapy for depression, which was widely accepted by the psychiatrists, but is still being used to some degree. But the mortality with that is 1 in 1,000. I mean, it's not good.
No,
it's not good, and it's been discredited.
Now,
So go ahead.
I guess what I was going to say is, I'm taking this little bunny trail, but the whole thing with mental health and the push is all on the drug side. Take more pills, solve the mental health problem. Where, patient. I'm just saying that
it makes
patients and families. I mean, see all this stuff happening in the world, and they're always like, it's hard to get people in for counseling and access to counselors, etc. So there's a push by patients and of course an emphasis on drugs, when it's the whole, I think, going about it the wrong way, in that we actually need to step back and look at why is all this happening, and it's a bigger societal issue, that we can't solve with a pill. We
Yeah,
have
but that's the next layer of corruption that's coming.
Yeah.
Because when I was still serving on a bunch of committees and quality assurance committees and whatnot for insurance companies that are medical company owned, it was the new thing coming out from the federal government and the state government was social contributors to health. In other words, if you're homeless, it's now a health problem.
I know.
And I'm like, I just sat there and I literally was almost banging my head on a desk. I said, so what? So we're going to prescribe people Prozac and buy them a freaking house? Like
Yeah.
this is nuts. Like, it's got to end. It's got to end. Like, doctors, Jesus was right. Only the sick need a doctor. And we made everything medical so we could make a pill for every single freaking problem and sell a bunch of BS to people. It just drives me absolutely crazy.
So the DSM, the DSM book, that yellow, whatever it is, they call it the billing Bible because it has codes that the psychiatrist can use to put a bill to vague syndromes that don't make much conceptual sense. And the whole thing was invented and propagated by psychiatrists in the pay of big pharma. And it locked people into these diagnoses, and the less sophisticated family practitioners, I'd like to think they're less sophisticated, they just gave a patient a little questionnaire, and I was guilty of this at the time. I've written 1,000 prescriptions for SSRIs a long time ago, before I understood a bit of it. So the other thing about psychiatry is that our social support systems, disability and all that other stuff, they have gone up in tandem, perfectly in tandem with increased psychiatric drug prescribing. And many people think that's causal. Makes sense to me, because what it does, we thought these entities waxed and waned. They got better and they got worse. People actually could spontaneously recover in many cases, at least for a long time. And with the medications, they're chronic. And you're basically locked into the medication. You're locked into the problem, because if you don't take the medication, you have a withdrawal that mimics the actual syndrome. And it doesn't prove that you need the drug. It just proves that you're addicted to the drug. And your story is actually a good story, because you had the wherewithal to stick with it and get off of it. And every single psychiatric drug is like that. The benzos, the SSRIs, the atypical antipsychotics, and the stimulants are all like that. They have horrible withdrawal syndromes.
Well, it's fascinating because I did a kind of a anti-bullshitology talk for a CME at one of our hospitals. This was, it's got to be close to 10 years ago. And I basically said, look, most of what we do doesn't matter. I mean, the stuff that we do that really matters, really, really matters. Like if you have a ruptured appendix, you need antibiotics and surgery and, a good washing out of your peritoneum and all of these things that we've known for a gazillion years. And I basically made the argument that healthcare, as far as actually really being effective, stopped at about 1960. By then you had antibiotics, you had vaccines for really bad childhood illnesses like diphtheria, you had reasonably good surgery and anesthesia, so that rapidly decreased infant mortality, because you could do a C-section without killing the patient from either bleeding or an infection. And after that, everything has been wildly more expensive, but incredibly inefficient. All the MRIs, all the new chemo agents, all of this stuff makes a difference sometimes for very particular patients, but mostly it just makes stuff really expensive.
And it's the art of medicine that's not being done. And instead, we're applying all these things indiscriminately to make the maximum amount of profit. The numbers your listeners should understand is that we spend double what any other country does on healthcare per capita. It's $4 trillion, and it's about 50% effective. The other half is either ineffective or actually harmful. And that's not academically controversial. That people write papers about that every day. There's a whole litany of things that we do that, I've included some here that just absolutely don't work.
$4 trillion. And our health in general, I mean, if you look at
it's declined, and we get worse results than all the top 25 countries. We get worse results than any of those countries.
Right, but like I almost pulled all my remaining little stump hairs out back when Obamacare was starting, and the president comes out and says, we got to do preventative health care. We have to, we got to treat the diabetes rather than chop the leg off. And I'm like, no, you don't understand. Most preventative health care is the biggest freaking lie in the entire world. Okay. Mammography makes virtually zero difference on whether you die of breast cancer. Makes some, but virtually zero. Colonoscopy
I
is
think it's zero.
fantastic.
I think it's zero, actually.
But
Colonoscopy is zero.
No question has extended my life. I have a family history. I had polyps.
Well, that's a different story. But screening colonoscopy doesn't do a thing.
Okay, different story. But bear with me here for a second.
Sorry.
Okay, but this idea that we can prevent our way into making healthcare cheaper is insane. Using the healthcare system, you can prevent your way into being sick and diseased, and you can extend your lifespan, and you can feel better, and you can get it up when you're 70 and all of those things, but it has zero to do with healthcare. It has everything to do with what you eat, how you exercise, the quality of your relationships, whether, believe it or not, you go to church or not. All of those things matter more. But what's happened is we have made everything a healthcare problem, because then it becomes a profit center for various entities. And I liken it to, if you need to hammer a nail, you use a hammer. It's an incredibly crude tool, but it's very effective. You don't hammer a nail in with my favorite tool I just bought, which is a $300 battery-powered impact wrench. You destroy the wrench, and you destroy the nail, and you don't build anything. Most of what we're doing should be a nail and a hammer, which is you eat a little bit less than you need to. You fix your relationships so that they're high quality. You don't drink too much. You quit smoking, et cetera, et cetera. That really has nothing to do with doctors. I didn't go to school to tell fat people they're fat. A mirror is all you need for that. You do not need my education.
Well, let's come up with another small disclaimer here. We're all traditionally trained doctors, and just because there are problems with aircraft design doesn't mean that magic carpets fly. So we're not alternative providers here. And of course, I'm retired, so we can go on with these industries that are such a problem. And you guys brought up the cardiac industry and stents, and sham surgery studies debunk stents. I don't know whether you're aware of that. I mean, they just don't freaking work. And there's the supposed case where they work is the only case where they're not used very often, which is during the massive heart attack when you have a lot of pain, right? They do it then, but that is less than 5%, maybe less than 2% of the people who get stents. And stents for asymptomatic people with no chest pain, no stable angina or whatever it is, they don't work, but that's where the vast majority of stents are placed. And probably that 85-year-old guy was part of that. And certainly, so coronary artery bypass grafting is also useless or harmful. It immediately kills 2 to 9% of the people who get it, and it gives long-term brain damage to a third. And the 3% with severe blockage of the left main artery, and for your listeners, it's a little artery from which 2 other arteries sprout. So this is a 2-centimeter area. So severe blockage of that one. Here's the improvement. The 5-year survival is 20% improved, right? So and the rest of the stents have been, or the rest of the coronary artery bypass cases, including left main equivalent, which is bypassing around all 3 arteries, doesn't freaking work. The studies have shown that it doesn't work. So,
but
low back. Yeah, go ahead.
It was interesting because when we were in medical school, in residency, they told us that. Like, we actually had professors that were, maybe it's a Canadian thing, that had the balls to say, look, the only thing that bypass has been shown to do is decrease symptoms to a degree, but not increase longevity, not save your life, et cetera, et cetera.
And symptoms are decreased by surgery itself, which is the biggest placebo ever.
Right.
You see? So pain has an avid response to any kind of surgery. Pain responds well to surgery. It's a huge placebo. And pain is the thing that placebos work best for.
I want to use a Jen Psakiism, circle back to this concept of just because there's problems in the aviation industry doesn't mean magic carpets fly. I love that. That I'm going to use that. That's going to be part of my vernacular. And as
it's not mine. It's it's the guy who wrote Bad Pharma, Ben, whatever his name is. Anyway, you can look that up. It's well worth reading. It's a decade old. Anyway, go ahead.
But it's fascinating to me because, and we've said this numerous times on the podcast, you need gigantic pharmaceutical companies because you need antibiotics, you need certain prescription medications, and they're not going to be made by small pharma. Like, I get that. And you need, you need a medical industry that has really great infrastructure so that you can, get your hip replacement, which is technically a luxury item, but a life-changing one for a lot of people. You need these things, you need, some cancer therapies have advanced wildly, and they've come through stumbles and starts and stops and all that. So like, I get that you need it, and I get that it's vitally important. I'm not saying that giant pharmaceutical companies shouldn't exist, but when you smell the stench, it doesn't mean they're all stenchy, but at the same time,
no, they're all stenchy.
You should 100% assume that you're getting screwed first.
Yeah.
If that makes sense.
Assume that that the medical studies and the rest of it is fraudulent until proven otherwise. So hang on, I got to backtrack a little bit. You're talking about oncology. Oncology is a mess. It's the second most corrupt specialty after psychiatry. It's the second most expensive nonsense. We only have about 8 diseases that we can treat, some lymphomas and leukemias and a few other things, right? Hodgkin's and testicular cancer, and the treatments work for those. But for everything else, the academic papers published about them say that they're trying to get 2-month improvement survival. It's a joke. $100,000 for each year of therapy on average.
No,
right. If you asked, a patient, it's like, if you had to pay for that out of your pocket, that chemo to get 2 months of your life?
Well, yeah.
Would you rather do that or take your family on a whole vacation around the world and spend quality time with them? But
exactly. But the king of kings of that is got to be the Provenge, the prostate cancer drug, which is a fascinating drug because it's a magic bullet drug. They take your blood and try to type these antibodies and then, give you the anti-cancer agent back. And when I first started researching it, it was close to 10 years ago. And it was three injections over like 3 or 6 months. And it is, this is the indication, okay? Castrate insensitive metastatic prostate cancer. So you have prostate cancer so bad that they've cut your balls off. You are obviously riddled with bone pain because it's end-stage prostate cancer. So it's like your wife has to hide anything sharp and all the guns because you're in such bad pain. But you can get this drug, and it was shown to maximize 6 months. So what happens is you get to die with this horrible cancer for an extra 6 months for the low cost of $90,000.
Yeah, if you believe that, you believe in the Easter Bunny, dude.
Yeah.
Let's dive into the sorry about the boomer euphemism. Dive in, right? Sorry about that.
Yeah.
But let's talk about prostate cancer for a second. We will talk about urologists. That's probably the 3rd or 4th most corrupt specialty. But let me finish with oncologists first. I got to slap them around a little more. So oncologists have a tremendous conflict of interest. They get 20% off the top of all the chemotherapy drugs they administer in their office. So they've got their goals are to have a room full of Barca loungers, right? Like the recliners with people hooked up to chemo every single day, and they make their freaking $2 million gross, and they take whatever it is they can get off the top. And so it's illegal. It would be illegal if I made up a drug and gave it to you guys and said, look, take 20%, sell it however you want. That's called capping. It's a federal felony, and we go to jail if somebody, and believe you me, there are people looking at us. They don't look at pharma. So the story gets more dark, right? Because these guys get rewarded by the milligram. It's not by a dose. So the drug rep calls and he says, you're only at 2,200 milligrams for the month. If you get a 2,800 milligrams, we'll give you 10% more. So these oncologists, Now, look, who can blame the oncologists? I mean, we're all idealistic. They think they're doing good work. They're trying as hard as they can with a tough situation where people are croaking around them and having all kinds of horrible problems. It's complex medicine, likes of which family practitioners and emergency physicians have never seen. It's detailed internal medicine. And, but these guys are, when they get these rebates, they become creatures of the pharmaceutical companies, essentially. And manipulating patient care with these financial incentives has an overwhelming potential for abuse. So that's the oncologist. I mean, it's a sad deal, and we can get on the urologists if you want, because
I guess that, I don't know. It's always easier to judge when you're not in that situation, right? And I haven't walked in the shoes of being an oncologist, but as a family practice doc with my patients, I mean, I mean, we all go to the same medical school, so to speak. We all get the same training, and then those that go into oncology, like I'm not saying they're all bad, but what happens where you're not greed, but the business part of you and trying to make money part of you takes over the what am I really doing for the good of this patient?
No. You're assuming that something changed. Nothing changed. It's just human nature.
Exactly.
And it is the best description I ever heard. A great friend of ours who was he was a nephrologist, and he had been retired for a few years, and he was very, very honest. And he said, I did peritoneal dialysis virtually all the time. It was easy for the patients. It worked reasonably well. It was no problem. And then I noticed about 8 or 10 years after I had owned part of a dialysis center that all of a sudden I looked back and I just kind of, I thought I was the most ethical guy in the world. All of a sudden, virtually all my patients are going to my dialysis center. And he just started laughing at himself. He goes, it was not a conscious thing. I just did it. And why did you do it? Because that's human nature. You have a financial interest. You do things that are in your best financial interest. There's no question about that.
Upton St. Clair said it the best. He said something to the effect that it's impossible for you to tell the man a truth and him to understand it if his finances stand in the way. So, I'm ashamed of the collective physicians in America. We've got 1 million of us, and we've only have a few who are standing up. But look at me. I'm retired. They can't get me. I can't lose my job. I can't lose my medical license. None of it makes any difference to me. So it's easier for me. I'm not so courageous. So what was the next subject? With the urologists, you want to chat about them a little?
Yeah. I think so. Share with our listeners what's going on in urology. What is the big corruption backstory?
So the surgery is not as carefully studied as medicine, and the fleas, which is what we call the internists, right? They used to call them fleas. You still do that? That was a long time ago. See,
no, I haven't heard that for a long time.
Okay, well, you have heard it, so you're within a generation of where I was. So they're the brightest, or at least purportedly the brightest of the physicians. Physicians are an elite group. There are 1 million of us with IQs averaging 130. There's no other group in the country as bright as we are. But we're trained and we're beaten into submission. We're not independent thinkers. And I have a hard time banging on these guys because they have to make a living, and they're not academic. I mean, I'm talking about physicians in general. But the internists have fewer excuses. But the surgeons are less academic, and their surgeries are not required to be studied as carefully. And the urologists have this surgery called a radical prostatectomy, which is an abject failure. In my view, it should almost never be performed. It causes incontinence and impotence in, I don't know, a third more. I mean, it's a horrible thing, and it in many cases they still have they have had the tumor already metastatic at the time they took out the prostate. And these people wear you guys have seen the ads for the Depends diapers with these kind of rough looking guys on TV. And nobody knows what those ads are all about except for the people that have had radical prostatectomies, and they're being induced to use Depends diapers, and a diaper ad for men over 60. What a travesty. But anyway, so these guys have a failed, and I go over the statistics about that surgery in my book. But worse yet, their chemotherapy approach, according to Otis Brawley, who is the head of the American Cancer Society, their chemotherapy approach with the prostate blockers probably kills more people than it saves. And Brawley thinks, now this hasn't been studied because nobody studies that, and we're allowed to approve these drugs based on almost anecdotal data about tumor shrinkage, these indicators that are not measures of fatality, which is really the only thing you care a darn about. So they're using this this drug that just is horrible. And I got interested in this because I learned about the virtues of testosterone. The other thing that they do is they don't use something that was well known at one time, and that is estradiol works very avidly to suppress prostate cancer, and it decreases the pain. It's for metastatic prostate cancer. And it decreases the bone pain. The guys are happy. They don't want to have sex, but they're not depressed like they are if they're off of hormones altogether. So that you take the best hormone of all, which is estradiol, and you treat the prostate cancer people with it, and they try not to give them so much that they get the gynecomastia, which is sometimes painful and can be treated surgically with very simple surgery. So in 10 seconds here, while I'm on the subject of estradiol, you probably weren't aware of this. I'm going to make a claim here that you're not going to believe. But if we got all the women on estradiol at the time of menopause, their chances of Alzheimer's would be cut by 85%. And I know that sounds like it's a crazy claim, right? But if you go to the end of Hormone Secrets and you look at Appendix C, I have 75 references that back that claim. So
sweet. I'm covered because I got my patch on as we speak.
Okay,
right.
I'll tell you something about that patch. The patch does not improve the chances of getting heart disease. You have to take oral estradiol. Right. You knew that, and there's no consequential disadvantage to taking oral estradiol, no matter what you have, because estradiol does not cause breast cancer.
Yeah,
it doesn't cause problems like that. So get on your oral estradiol, 2.5 milligrams.
Forget my patch.
I just can't.
Well, you can take them both. I got my wife. My wife is taking both. I'm not treating my wife. I didn't admit to that.
I can't.
You're just providing her with a lot of advice.
Exactly.
I have very little influence over my wife.
I love it. That's funny.
No, I'm trying to imagine being on estrogen and no testosterone, and
on you.
Well, yeah, like if you get prostate cancer and how estradiol works, and you sit there and you go. So
some people put them on testosterone too in larger doses, and because you guys both know that testosterone is broken down to estrogen, and so you get the good effects of that. And some people have treated metastatic prostate cancer with large doses of testosterone, and that is in anecdotal, they're observational studies. It's thought to have been effective, but there are just a few reports of that because nobody will run a large study because the stuff isn't patentable. You can't patent testosterone.
And that's what just blows my mind. It's like there's just this void of common sense. Okay. So when do men get benign prostatic hypertrophy? It's when they're older. So they have a higher estrogen level and they have lower testosterone levels, or they have low testosterone and estrogen together. So you don't see a 19-year-old with a total testosterone level of 900 with a giant prostate. So how on earth is testosterone going to cause prostate problems? Like just seems counterintuitive.
There's no evidence that it does. Those nobody knows the cause and effect of the things you mentioned. So who the freaking heck knows about that stuff? But people, men and women, benefit tremendously. Probably have much better longevity if they get on their hormones and at 50. At whenever I identify these women in their late 30s who were menopausal, and they would, the difference between them getting on hormones and not was be the difference from completely falling apart with osteoporosis and all kinds of other problems. And estrogen is the best hormone. Take that one to the bank.
That's what
for men and for women.
We can do a whole show on
well,
this.
Maybe we should. That's what drove me just completely crazy with just the male hormone replacement therapy. So a guy comes in, he's 75, he doesn't feel good. They get a testosterone level on him. It's 150. So they give him this massive dose of of depot testosterone once a month, and then wonder why he doesn't lose weight, doesn't really feel much different. Well, he's converted most of that to estrogen because he got this huge dose initially, and he's not in steady state. And then secondarily, you're treating him 25 years too late. Like every end organ is dead by that point. Like, it's the flogging of a dead horse, literally. And I'm like, no, you're going to treat that guy at 50 or 45 or whenever, he starts feeling kind of crappy and his level starts to drop.
Well, I think it helps in older patients as well. It's not quite as dramatic. And obviously, the testosterone injectable is probably best at weekly intervals or bi-weekly, at twice a week, because you get more steady state levels. But even at weekly intervals, you do experience some differences during the week, which nobody knows whether that's harmful or not. I mean, there are people who theorize, including my mentor, that using the cream testosterone, it gives you much more even levels, and that's beneficial. However, no one's proven any of that with study. And so personally, I use injectable because it's so cheap. It's like $10 a week.
Yeah.
It's $10 a week. It's $1 a week for women if they use injectable
It's
testosterone.
horse testosterone.
It's not horse testosterone.
It does.
It's synthetic testosterone.
Yeah, no,
I prefer to call it.
I'm flicking a joke as in reference to the horse paste for COVID.
I prefer to call it stallion juice.
Only because women's estrogen used to come from horse mare urine. So there you go, or progesterone. I'm getting
that's
estrogen.
Stuff.
Prem-RN, pregnant mare's urine.
There you go.
It still has its uses, but it's basically completely obsolete for chronic use.
Yeah. So, okay, back to your book, which has got me excited. Is let's go into the insurance side. Do you write much about that in your book, about all the insurance?
Frankly, that was hard to that was hard to research, but I can tell you that it's they get at least 20% off the top, and some of the Blue Cross and Blue Shield, they get 35% off the top. And in an industry like workman's compensation, it's 30 to 35% off the top before anyone gets a dime. And of course, the plaintiff's lawyers downstream get a lot of it too. It's an insane model, but it's not the worst healthcare model. You know what the worst healthcare model is?
A single payer.
The worst healthcare model is personal injury.
Oh,
where the expenses are like 85 to 95%, and I break it down in that book on in the worst healthcare model. I think there's a chapter on the worst healthcare model. Wow. Can you imagine? The fraud component of personal injury could easily be 30%, right? And It's got all the other expenses baked in too. The attorneys got it. The model is the attorneys get a third of the net, right? Mm-hmm. Not counting the fraud. The fraud's taken off the top, and then there's 30% for the insurance companies, right? So I'm sorry, the insurance companies aren't involved with that one, but the attorneys get a third, the patients get a third, and the doctor gets a third. That's the general, and that's what, if you start doing that work, the attorney will educate you as to how the split is made up.
Wow.
Yeah, no, it's.
Alternative careers in healthcare.
Yeah,
has a shed new light on me.
But it's fascinating.
Healthcare.
Yeah,
it's fascinating because we've started doing some complementary infusions at our clinic and looking into that whole world and how vitamin C infusions, NAD, which I think is just absolutely a mind blower. We've treated some patients with post-COVID syndromes, and it's amazing how much better they feel. And, I was talking to this friend who owns an independent infusion center. And she goes, if I took insurance, it would be 4 or 5 times more expensive. And the answer is yes. Everything in healthcare is way more expensive with insurance. And people forget that. Like, how, just common sense, 10,000 foot view. How does it get cheaper when you have a middleman in between the producer, the doctor, and the consumer, the patient? Why does adding a third person make it less expensive? It can't. It can only make it more expensive.
The U.S., as I understand, is the only country in the world that has this much involvement of the insurance company with the healthcare system, and it is just insane. I mean, these people are pure profit, and they're not. I mean, the doctors are the only ones with any ethical training or any interest in the patients, and they don't have that.
So, what are your thoughts? Any big, I don't know, ideas how to not take back healthcare, but how do we squash this whole problem and start over? I mean, you literally have to kill it and, I don't
Okay.
know, just start from scratch.
Okay. So this the thing I want to emphasize for your listeners is that the problems we're seeing with the COVID narrative are not new. They've been going on for in a terrible fashion for 20 years and to a lesser degree before that. And one of my academic friends said, sort of to what your husband said, he said that the medical progress has been modest, if any, in the last 20 years because it's all been money driven. So to answer your question, though, what seems to be the only path forward is we have to squash this COVID narrative in an aggressive fashion. And it looks like the Pfizer documents are a lever, and whether or not the plaintiffs' lawyers can kill Pfizer and Moderna, because if you kill the Chinese saying is, if you kill the chicken, you scare the monkey, right? So this might be an attack vector on the rest of the industry. But the thing is so big and so entrenched. It's $4 trillion industry. They dominate Congress and the executive branch. They push the tech companies around. I mean, it's incredibly lucrative. Pfizer's probably made is projected to make $100 billion on this one drug alone. And Pfizer's profit margins for the last 4 years have been 40 to 50%. And now this year, who knows what the heck the profit margins are? I mean, they're probably 75%. I mean, who knows? Because the government's doing the advertising for them. I mean, it's crazy. But if we can take down Moderna and Pfizer through the plaintiffs' lawyers, and incidentally, the federal prosecutors are powerless because they want those jobs later in industry. They want the payoffs now. I mean, they're completely bought and sold. So they basically settle all these cases. I mean, this $50,000 or 50,000 patient fatality Bextra case, that should have been $20 billion. And it was settled for 2.3 or something like that for Pfizer. It was the biggest settlement ever at the time, criminal settlement. But if we can take down these two pharma companies with the plaintiffs' lawyers, and I can tell you they're massing for the attack. And there are whistleblowers. This Dowd guy, you should listen to him on Children's Health Defense. He's got RFK interviews him, and it's the most heartening interview I've heard in a long time about our situation. That maybe possibly we can change healthcare, but the global picture is so much worse, and there's so many other actors involved that it's this. You said that you promote Peter Bregan's book, COVID-19 and Global Predators. We don't have to get in great detail today about that because we're a bit out of our sandbox. But the global picture is very dark indeed, and unless we can take down Pfizer and Moderna, I don't think there's much of a prayer for reversing all the. But we got to talk about it, and we've got to get as many people knowledgeable as we possibly can.
Yeah.
As an individual, there are ways that your patients can deal with healthcare. The first thing is, if you're not getting better, you get an outside consultation virtually. And this has been accessible. The medical boards can't criticize it because there was Trump put through an executive order as of 2 years ago that you can do it. So you can go to Stanford or Harvard or wherever and go to I mean, these guys are smarter than us, and a lot of them have personality skills, and some of them don't, but they if you've got an unusual illness, it doesn't do any harm to spend the money, get that consult, have them review your chart. The other thing you can do is that's new in the last few years is the patient advocacy groups. And I recommend that anyone with young people don't need this, but if you've got an oddball cancer or something, get into those groups, talk to the patients. There are people there who will sometimes give you more information than any doctor. So none of those things are magic pills, but that's where I see it.
But I think it brings I think it puts the light on a bigger point, which is, healthcare's your problem. It's not like you're not a victim of this. You need to figure out how to solve this problem. Physicians are advisors. They're not gods. They are fallible. This has been ridiculed through COVID, which just makes me crazy. I did my own research and I'm not getting the vaccine. Well, you're not an expert. You should just listen to experts. And I'm like, well, I'm not a freaking sheep either. So yes, do your own research. It's your body. It's your health. We are advisors. Find somebody that you can trust. Get another opinion if you need to. We did an interview several months ago with a local podcaster who actually became a friend of ours, and he got prostate cancer quite young in life. I think he was in his 40s or he just turned 50, and he did tons and tons and tons of research because the solution was radical prostatectomy. That was everything. He goes, there's got to be another way to do this, because he looked at the side effects and he's like, I'm
Maybe
only
not.
50, I'm super fit, and I really want to be able to get it up. And he did a different therapy, did well, and he said, I have protected my boners.
Yeah.
Well, the thing about prostate cancer is that 70% of us have it at 70, but only 2% of us die from it. So even if you've got, the problem is they're doing all this screening, and the screening organization at one point, I forget, it's the United States Preventative Service Task Force, UP,
Right.
whatever they are.
Yeah.
They recommended against doing PSA testing. And then, of course, the urologists screen bloody murder because it destroyed their industry. The whole thing is a cascade of misadvised medical care. You get the screening, and the people who support screening clinics are often the Depends diaper people, the drug people, and so on and so forth. So it and the hospitals, the hospital representatives can describe the exact amount of revenue that comes. You do 1,000 screenings, you get so many incidents of prostate cancer, you get so many radical prostatectomies, all hospital revenue, you get so many penile implants for impotence. I mean, it's utterly crazy. So anyway.
Yeah, no,
Wow.
it really is.
I'm depressed now.
No, but I want to bring this back.
I need to get another SSRI. No, I'm kidding.
Here is the problem. Here is the problem with healthcare. It's I know that you've done action sports and whatnot, and you were a climber, and I'm a skydiver and ride motorcycles and all this stuff. Okay, the problem with those activities is not that they're the problem is they're inherently dangerous, but you can do them in a safe manner.
Fairly safe manner.
Fairly. The biggest issue is
you tell them
when you make a mistake, they're wildly unforgiving. Okay. Like wildly unforgiving, right? Like if you look down at your phone at the wrong time when you're riding across the country at 80 miles an hour, you're dead. And so it's the unforgiveness, and it's the same thing I see in healthcare. We need doctors, we need hospitals, we need ethical drug companies. We need all these things. We need them like crazy. But you still have to be careful, okay? Just and I hate the throwing the baby out with the bathwater, which is just because there's corrupt health systems or just because the system itself is inherently corrupt doesn't mean it's all bad. We still need this. We still need therapies. We still need research. We still need all of this. But I'm not here to bash everything and tell people that doctors are full of crap and don't go to your doctor if you're sick. I'm saying use your head and be careful.
Okay, so I'm going to give you I have to dive into the motorcycle thing. I got to support May here a little bit.
Yeah.
So I'm going to tell you how I studied and wrote about risks in rock climbing. And I finally decided that the risks are unsupportable. They're unreasonable. And the reason is not that most of the risks are self-generated, but the problem is when you make a decision 1,000 times, sometimes you make the wrong decision. And for example, I tie a knot every time I go climbing multiple times called the figure 8 knot. It's very easy. It's easy to look at and be sure it's right. But one day I was doing this rope solo, which means that you have a friction device on the rope and you attach it at the top of the cliff and you go up and down this thing in order to practice a climb. And I climbed up, using a certain technique, and I tied the knot to the anchor, which was fixed. And then I went down and on rappelling on both strands. And then I went up one side. Now, when I got to the top, I realized I had mistied the knot. And if I would have fallen on the top of that thing, or at any point I would have fallen to the ground. Right. Ooh. And I got to the top and I just shook my head. It's no harm, no foul. Right. But I've never mistied that knot to my knowledge ever before. But it's like pulling out in traffic. You can have a perceptual issue and look to your right, never see the truck coming down. Now, that doesn't happen very often because you have good eyes, and maybe our eyes are not as good at 68 as they are at 55, but you look and you don't see it. And I pulled out in traffic and missed things, and people would come barreling past me, blowing their horn. And it's the same thing with any human endeavor. So if you really enjoy your motorcycle thing, you can continue it, but the universe of your risk is dependent on how much time you spend at it. And so I would advise enjoying it in smaller quantities.
There you go. I love it.
Same thing with rock climbing.
It's the risk benefit and quality of life, and he starts to drive me insane if he doesn't get on that thing every now and then.
I ride between
so
3,000 and
I don't
5,000
know.
miles a year.
Maybe,
but usually in big chunks.
Yeah.
Having a marriage with a happy spouse, even though he gets splatted at the end of it, is worth the cranky spouse that lives forever. I don't know.
Her goal is, if I go in, just go in hard. I don't want anyone disabled.
Well, we've all spent time in the neurosurgical intensive care ward, and we've seen the disasters from the motorcycles. Yeah. So be careful, dude. We don't want to lose you.
Yeah.
No kidding.
No.
So tell everybody where they can get your book and where they can find more about you on your website, etc.
Okay, so my two books are Hormone Secrets and Butchered by Healthcare, both of which are the easiest thing is to order them print on demand from Amazon. And they're only $3 each as Kindle books, right? I kept the prices low because this is a passion project, and I'm not, So my website is robertyohoauthor.com. And the other thing I have is a Substack blog. Substack's a critical area that your listeners should know about to get the truth. And it's robertyoho.substack.com. And if you guys, I'm speaking to listeners, if you want more information, the best podcasts are probably Peter Breggins at Breggin.com, BREGGIN.com, and his book, COVID-19 and the Global Predators. And I like RFK's blog better than any of the other ones. He's just absolutely modest, and he's a great man with a capital G, who we should all need to watch.
Perfect. We'll link all that in our show notes and the others as well. I'll do that. Peter Breggin's been on our show before, and we shared that with you too, but I can refresh all of that. And thank you so much for taking the time with us here today. It's been super fun. And I know we will get requests to have you back, and we got to do a show on the hormones because my girlfriends and our female listeners are always bugging to talk about all that stuff. And I know the guys secretly want to hear
we'll do a stallion juice episode too.
Stallion juice. Okay, you guys can bro out and do stallion juice.
But that's absolutely correct. That would be really fun. And common sense has been the biggest loss, I think, in the last however many years I started sniffing out BS in healthcare, and the thing that really tipped me off was the opioids. I'm like, this is nuts. Yeah. No one wants to write these prescriptions. We're doing it like crazy. The only people that want it are the patients and the guys making the drugs, and it's based on zero evidence. I said, where's a randomized controlled trial that you can give somebody a long-term opiate? And it's just we did 4 episodes on that because it's just it's
an outrage. It's an outrage. It's an outrage. Totally. Purdue Pharma and some other pharmaceutical incest both were bankrupted by plaintiffs' attorneys, who were essentially the only power here, because they had the blood on their hands of hundreds of thousands of Americans. It's crazy. Johnson & Johnson distributed a lot of that stuff. The wholesalers distributed it, but Purdue was leading the charge.
Well, we'll see what happens, because as much as, doctors tend to not like lawyers may end up saving the country. I'm quite convinced of it, actually.
Never thought I'd hear you say that.
Well, and I will be transitioning to even more amazing than
You're transitioning. Is he really transitioning?
No.
Time to cut this off.
I'm transitioning.
Yeah, well, we're not going to cut it off. We're not going to cut it off.
The show.
Okay, yeah.
I said that. She goes, okay. She goes, I'm cutting you off. And I'm like, what do you mean? You've been cutting me off for 30 years. And she goes, that's not right. That's
you guys
totally
have a great relationship. I can see how much you love each other.
Yeah, it's our biggest it's weird, but our marriage appears from the way we relate to each other seems to be the biggest selling feature of this podcast.
People are just like, talk more about your guys' relationship and stuff. It's super funny. I'm like, oh goodness. Yeah. Anyway. Well, yeah, I can't hardly wait to have you come back so we can do more on the hormone, and I'm going to get that Kindle book right away because
I sent it to you, I think.
Yeah, maybe.
I'll send it to you. I'll send it so you can download the Kindle.
Yeah.
Well,
thank you. Yeah.
Well, of course, it's $6.
All right. Yeah, exactly.
I gotta keep my brain intact.
Don't spend it all at the same place.
Yes.
All right, Dr. Robert Yoho, thank you again. That was awesome. I needed to vent, obviously, because this stuff's been piling up in my life for 28 years. Great to find like-minded people. I think that's an important thing we need to do. And there's more of us out there than I think people would know. So thanks again.
It's my honor. Thank you.
Well, we could talk to Robert for hours, and I think we will because he will come back, and we're gonna dive into some other.
Yeah, I'm ready to pick his brain on hormone secrets, seeing as I'm in that phase of life, and I guess I'll use my human body as an experiment. But we've been peppered with questions from our listeners, and so I think it would be a really good interview and to pick his brain and have him tell us what he's written about in his book. So can't wait. Before we end, don't forget to reach out to Michael Relvis at MR Insurance, where their goal is to assist physicians in obtaining the most comprehensive coverage available to fit their unique situation. Reach out for both excellent and quality service at No, don't reach out to BS Free MD because that link doesn't work. Just reach out to mr-disability-insurance.com and he'll be happy to get back to you. I will link that proper link again in the show notes, mr-disability-insurance.com. And we can't wait to see you next week. We'll have some new and exciting doc tales coming up soon.
Yes, and lots of episodes we're working on with Doctor as Patient. Lots of stuff. Like it's been kind of blowing up with regards to interview requests and so forth. So
if you know
please share the word. We want as many listeners as possible. So
you can like us, comment, send us an email. If you know anyone that would like to be a guest or you think would be a good guest, let us know. But also, if you are interested in being a guest as Doctor as Patient episode, where you actually have gone through any kind of medical, event, struggles, any life-changing event that's also impacted your career and how you see patients, or even if you're not practicing, how it has changed things.
So would my penile reduction surgery count as Doctor as Patient?
I'm at loss for words. I'm sure people would love to hear about that and how life is for you now. So let's just leave small things lay where we may. I don't even know.
I love it. I can like verbally hijack you and
this needed to
throw you to the ground.
This needed to be a doctor for you to drop that kind of a bomb on me. Oh my gosh.
That's what makes it fun though. It's like, I got a great grenade. I'm going to throw it out there and she's going to have to smother it.
I don't know.
But you can't smother it because my grenades are of such power. Intellectual grenades of power. Thought grenades. Unparalleled thought grenades.
Mic drop. Yeah. Well, on that note, see you next time.
It's no secret that medicine is a bit uptight. That's why Tim and I created BS Free MD to mix things up a little and have fun in the process. Besides, we are having these exact same discussions all the time, so we thought we might as well invite everyone to the party. If you really like us, you can get plenty more and maybe see one of Tim's cool tattoos on our Instagram or Facebook pages at BS Free MD. See you next time.
While we try to keep BS Free MD as raw and real as possible, we can't be held responsible for any medical decisions or discussions had as a result of what you've heard on the show. We know, bummer. But the truth is, we really do care about your questions. So feel free to reach out to us by email at doc at bsfreemd.com.